This is a recording of Chapter 28, Muscles of Mastication, hyoid muscles, sternocleidoid mastoid muscles, and trapezius muscles. So in this chapter, we're going to look at the origin, insertion, action, nerve, and blood supply of the muscles of mastication, the roles that they play, how they move up and down, side to side, how they move the mandible around. Then we're going to look at the function of the sternocleidoid mastoid muscle and the trapezius muscle, and how they affect and refer pain in the head and neck area, including TMJ dysfunction as well. And we'll look at the suprahyoid and infrahyoid muscles, looking at how they move the mandible again, and swallowing and speaking as well. So the general rules that I want you to remember when we're talking about these muscles of mastication is that all of these muscles have an origin. So the origin is the end attached to the least movable structure, okay? So that's where it's starting from, right? The least movable structure, whether it be the maxilla, the mandible, the hyoid bone, whatever it's going to be. And then the insertion is where that muscle is inserting to. So that is the more movable structure, okay? And when we talk about action, that is the actual work that happens when those muscle fibers contract. So that action can be lowering the lower jaw, raising the lower jaw, retruding it, or moving it side to side. Okay, so the action is the movement when the muscle contracts. When we talk about the muscles of mastication, there's really four pair that we discuss. They are the temporalis, the masseter, the lateral pterygoid, and the medial pterygoid. Okay, all four of these muscles of mastication attach somewhere onto the mandible. Okay, the origin starts somewhere else, but they attach down into the mandible. Okay. So these four muscles of mastication, they are all responsible for elevating, protruding, which is sticking out, retruding, so pulling in, or moving the mandible from side to side, that lateral movement. All of these muscles of mastication also develop from the first or the mandibular pharyngeal arch. They are all innervated by cranial nerve number 5, which is our trigeminal nerve. And more specifically, coming off of that trigeminal nerve, they're innervated by C3. The blood supply for all of these muscles of mastication are going to come from the maxillary artery. There is a video link in your slide presentation for a YouTube video on watching, obviously, a video on muscles of mastication. So let's break it down and look at these four different muscles. So our masseter muscle, we can see it here on our diagram, okay? It's this kind of rectangular muscle that lies here inside the cheek on the side of the face. It's a paired muscle, so there's one on either side. It is one of the most powerful muscles of mastication. In some people, we will see this muscle be hyperdeveloped. We can see it in gentlemen sometimes when they're clenching their jaws together and they're getting kind of the ticking motion of that muscle down around the angle of the mandible. Okay, so this muscle is very strong. If this muscle is overdeveloped, we have to think about bruxism happening with this muscle. As we can see, it's coming from the zygomatic arch down to the angle of the ramus, the angle of the mandible. So that's going to have a lot of compression. It's going to put a lot of pressure on the cheek. When we open the mouth, when we have somebody that has that hyperdeveloped or some tenderness in that masseter muscle, and we open their mouth, the first thing we're going to look for is any sort of occlusal wear that gives us an indication that that person is bruxing. Okay, So we might see wear on the teeth. We might see a bilateral linea alba as well inside the mouth. We might even see some attrition happening on the anterior teeth. So this muscle, it lies superficial to the pterygoid muscles that we're going to talk about and to the temporalis muscle. So this masseter muscle is going to cover all three parts of all three of the other muscles of mastication. So this masseter muscle actually has two parts of it. So there's a superficial part, so that's the covering. It's going to originate from the maxillary process of the zygomatic bone, as we can see here. Okay, there's our origination. And the deep part, as we see here on our diagram, it says deep layer. So the layer underneath is going to originate from the zygomatic arch of the temporal bone. So just a little bit further back. And both of these parts of that masseter muscle are going to come down and attach onto the ramus of the mandible. So when we activate this muscle, this masseter muscle, it's going to elevate the mandible, closing the mouth for us. Okay, so that's the action that the masseter has. It closes for mastication or when we're talking as well. The next muscle we're going to look at is called the temporalis muscle, okay, or the temporal muscle. We can see it's a fan-like, fan-shaped muscle coming from the temporal region of the skull. If this muscle contracts, it's going to elevate the mandible again. It also has two parts of it. So it has a superior and an inferior portion of this temporalis muscle. The origin is coming from the temporal fossa up here, and they're both going to insert down here onto the coronoid process, okay, right behind our coronoid process. Fibers of this sometimes also run down the anterior border of the ramus. So it may come down, let's get my cursor, come down behind that coronoid process and insert just behind the lower third molars. Okay, again, as I said, cranial nerve number 5, and our vascular supply is coming from our temporal artery. When this muscle is really used a lot for mastication or in our clenching and grinding, we will get headaches in this area coming up the side of the head from the overactivation of this muscle. So when we have that pain in our temple area or that tension headache that we get up in that area, quite often it's from overuse or overstimulation of this muscle. So we have our two pterygoid muscles. We have a lateral and a medial pterygoid muscle. So our lateral pterygoid, okay, is going to come as we see this red area here across the skull. We're going to have a superior and an inferior head of this lateral pterygoid muscle, okay? So we have our superior coming up a little bit higher under the orbit of the eye and our inferior head coming right across the maxilla. So when we activate this lateral pterygoid muscle, it's going to protrude and depress the mandible, okay? So it's going to help move that mandible down to open our mouth. There's two origins from it. So for the superior portion of the lateral pterygoid, it's coming from the infratemporal crust, right up in here, down into the wing of the sphenoid bone, okay? Our inferior origin is going to come from the lateral side of the lateral pterygoid plate, okay? We can see here in this lower diagram, in this one it's a green color, and this is looking from inside the skull. Okay, so it's coming across here. There's our superior and there's our inferior on both sides, as we see. So this again is kind of a fan-shaped muscle, as we see. It expands out from the corner of the mandible, or the corner of the condyle over here. Uh, and some of the fibers of it are going to insert into our TMJ disc that's up in this area. Okay, they're starting from there. As we see, we have another muscle that's coming down in a vertical position. So that is actually our medial pterygoid muscle. We can see it here inside the skull as well, and coming down from the outer portion. Okay, so we'll talk about that one. Oops, sorry. So our medial pterygoid muscle, when we contract this muscle, as we see it comes down right here, when we contract it, it elevates the mandible to close the mouth. This diagram actually gives us a little bit better view of that lateral pterygoid muscle as well, how it fans out here, and it's making contact with the skull on the point of insertion over here. So our medial pterygoid, the one that's coming vertically down, the origin is coming from the lateral pterygoid plate again, and from the process of the palatine bone. Okay, so we're starting here and we're coming down. Our second one, our second portion of it, is going to come from the maxillary tuberosity, and it's going to come down and join. Okay, so again, these two portions of this medial pterygoid muscle are going to insert into the angle of the mandible. Okay, so we have one we see coming down here and coming to the angle of the mandible. So here's where it's starting, in here in the lateral pterygoid plate of the sphenoid. Here's our mandibular condyle up here, and we can see here's our superior head, there's the inferior head, and we're coming down. Okay, that's our lateral. Here's our medial coming down. So just a quick summary. So our masseter has two heads, or two portions of it, a deep and a superficial. The superficial head is on the outer portion, closer to the cheek, and it is the bigger area. Their origin is the zygomatic arch, and again, it's going to insert into the mandible. The action that it does is to elevate the mandible. The temporalis is that big fan-shaped muscle coming from the temporal fossa and inserting around the coronoid process. The temporalis muscle elevates and retracts the mandible. Our medial pterygoid is, again, has two heads, a deep and a superficial. The deep head being the bigger portion of this muscle. The origin of them, they're both coming from the lateral plate of that pterygoid process, and then as well from that maxillary tuberosity, and both again inserting into the angle of the mandible. The action of the medial pterygoid is it's going to elevate the mandible. Remember, the medial pterygoid runs vertically, and the lateral pterygoid runs horizontally across the face. Okay. So the lateral pterygoid, the last one, again has two heads, an upper and a lower. The origin is going to come from the infratemporal crest of the greater wing of the sphenoid bone, and the lower head is coming from the lateral surface of the pterygoid process. Okay, and the action of this lateral pterygoid muscle is going to be to depress the mandible. So let's have a closer look at these muscles. There's all kinds of different 3D models that you can look at just to get a better look at them. But here we see our temporalis, that big fan-shaped muscle. Our masseter muscle is going to come straight down here, and it's covering where our lateral pterygoid comes across, and our medial pterygoid comes down. Okay, so the masseter is one of our big cheek muscles back in this area. I'm just going to flip us over for a second and just look at this 3D version. Okay, so we can see again, here's our temporalis, here's our masseter muscle. If we flip this up, we can see how they're inserting down into onto the angle of the mandible. Okay, and we can see from our inside version, we have our medial and we have our lateral pterygoid muscles in here. Okay, so they're kind of hidden when we look from this lateral position. They're hidden by this masseter muscle that we have. Okay. So, which is not a muscle of mastication? That's your question. We'll take that up in class. There is a Quizlet as well for you if you want to go over and have a look at that, just to have some practice. So those are our four main muscles of mastication, mastication being our eating. So there are some other muscles that we need to talk about in the neck region. Okay, so we have a series of muscles called our hyoid muscles, and all of these muscles have some sort of association or attachment with this hyoid bone. Okay, we've talked about that hyoid bone before. It's kind of a horse-shaped bone that sits in our throat area. We have our larynx that comes down. We have our thyroid, okay, and going down further down the respiratory tract, our trachea going down into the lungs. So our hyoid bone sits not too far down underneath our chin, up in our upper neck region, okay? So these hyoid muscles, they are used for usually depressing or opening the mouth. Some of these muscles have something to do with retrusion or pulling back of that mandible as well. Excuse me. When we talk about these hyoid muscles, quick drink. When we talk about these hyoid muscles, we usually divide them into two groups. We either have the suprahyoid, and those muscles mean that they're above the hyoid bone, or we have the infrahyoid muscles, which are all below the hyoid bone. We can see some of the marked off here on our diagram for us. So we're going to look at the suprahyoid group first. The first set that we're going to talk about are the digastric muscles. So, excuse me, these digastric muscles, we can see this is called the digastric belly, the anterior belly of the digastric muscle. These are muscle fibers at the ends, and they tend to have a tendon in the middle. The action of these muscles is to retrude the mandible, but they can also, in their action, they can lift up that hyoid bone. Here's our hyoid bone right here in the middle. They can lift it, okay? They can also pull on that larynx, and as I said, they can pull the mandible down, so they can retrude it and they can pull it down. The origin of this digastric muscle is in the digastric notch of the temporal bone, and I have a better picture of that for you, I think, on the next slide. The insertion of this digastric muscle, it's going to go into the digastric fossa, which is on the inferior surface of the mandible at the midline. Okay, so we have that muscle coming up, and it's going to insert inside the mandible, okay, right at the midline. We do have a sling of fascia that allows the tendon to go through up in this area for us. And the anterior digastric belly continues from that tendon up into its level of insertion. Okay, so really we're looking down here, pulling on that lower mandible. Okay, as I said, it can retrude the mandible or help to pull that mandible down. Okay, so here's a little better look for us. Here's this digastric muscle for us. So the origin is the digastric fossa of the mandible. Okay, and we can see it's coming down. It has that little tendon and it's coming back up. Okay, so it's kind of a sling. I've lost my cursor. It's just kind of a sling right here underneath our chin. Okay. So, also a suprahyoid muscle is the mylohyoid muscle. So basically, this muscle forms the floor of the mouth. If we look at our diagram, we can see it coming kind of um, obliquely here on either side of our digastric muscle. Okay, so it's coming down here on the side, and it's forming the floor of the mouth. So if you feel underneath your jaw on either side, that's what you're feeling under there is that mylohyoid muscle. The action when this muscle is contracted, it depresses the mandible or it can elevate the hyoid bone. This muscle begins from the mylohyoid line on the medial surface of each side of the mandible. Okay, so it starts right up in here inside the mandible and it inserts down, as we can see, into the hyoid bone. Okay, and they fuse together. We see all this muscle on either side coming down, and it's going to fuse together around the midline of the neck. Okay, this kind of fusion is called a reg. Again, we have our blood or our nerve supply from the trigeminal nerve, and our blood supply is coming from the inferior alveolar artery. Okay, so myohyoid, think, forms the floor of the mouth. So we have a geniohyoid muscle as well. Okay, so our geniohyoid, looking at our diagram, is coming vertically right down here, down and inserting again into that hyoid bone. The action of this geniohyoid muscle, when we activate it, it again will depress the mandible and it can elevate the hyoid bone. This muscle, the origin of it actually is from those genial tubercles or the mental spine area just below our tongue on the surface of the mandible at the midline. Okay, so right underneath our tongue, it's going to start from that area. It, as I said again, it inserts into the hyoid bone. Okay. So depresses the the mandible again. The styohyloid muscle, okay, is coming down here vertically, kind of vertically on the sides. Okay, we come down either side. It pulls the hyoid bone up and back. So the origin of this muscle is from the styloid process. Remember that little sharp little spiky, we can kind of see it right here on the other side, that styloid process. So it's starting from there and it's inserting again into the hyoid bone. Okay, that styloid process is a really tiny little bony extension coming down from the skull there. But there are a lot of muscles and things that attach to that area. And the stylohyoid, okay, stylo because it's attached to the styloid process, and hyoid, it's coming down to our hyoid bone. So it's sitting right there. So this muscle splits and part of the posterior portion of it comes down through the digastric muscle. We have that passing through it in that area. That's about it. Next, we have this infrahyoid group. So we're going to talk about the omohyoid muscle. Okay, so that is right here on our diagram. And if we look at the lower diagram, we can see it kind of has two parts, okay? Has an upper and a lower portion, and it has a tendon in the middle, okay? So we're coming down from the hyoid bone and we're coming over to that scapula area. Right around there is where it's going to come from. So, as I said, it's two bellies or two parts that's separated by a tendon. When we activate this muscle, it's going to bring the hyoid bone down. To feel that muscle, if you kind of tilt your head back and to one side, if you kind of just come down the side of your neck, kind of, where it gets sore and we're going to it's like we're kind of pushing food down our neck, massaging down that area. That's our omohyoid muscle. We have the sternohyoid muscle as well. Okay, so the contraction of this muscle again is going to pull the hyoid bone down. It begins in the upper border of the manubrium, okay, around the sternum, and it's going to insert again into that hyoid bone. Okay, so we see it right here, okay, coming right up into, so from this area in the sternum right up into the hyoid bone there. The contraction, sorry, I have to, it's two different ones and it looks very much the same. So this is the sternohyoid, okay, coming from the sternum up to the hyoid. Then we have the sternothyroid muscle, okay. So here's our sternothyroid, okay. So again, it's coming from the upper part of the sternum going up into that hyoid bone. When this muscle gets contracted, it's going to pull the larynx down for us. Okay, we also, there's so many and they get confusing. We have the thyrohyoid muscle. Okay, we can see it right here. It's a little bit more to the lateral, to the side. Again, it's going to originate from the oblique ridge of the lateral side of the thyroid cartilage. Okay, right up in here. And it's going to insert up into that hyoid bone. So when this muscle contracts, it's either going to lift that thyroid cartilage, or it's going to raise the larynx, or it's going to push that hyoid bone down. Okay, so this slide's just showing us about the general movements that we have in our jaw. We know our upper jaw is stationary. It's the lower jaw, the mandible, that has the movement. Okay, so the movements that we see are protrusion, retraction, elevation, and depression. Okay, so to protrude the lower jaw, that's using the lateral pterygoid and the medial pterygoid muscle. Okay, so that's pushing. We can see the purple arrow that's pushing our jaw out. If we want to pull that lower jaw back, so we want to retract it, we're going to use the posterior fibers of that temporalis. We're going to use the deeper portion of the masseter. We're going to use the geniohyoid and the digastric, so the muscles just underneath our jaw. If we're going to elevate, so pull our mouth closed, we're going to use the temporalis, the masseter, and the medial pterygoid. If we're going to let the lower jaw open, so that's our depression, opening of it, one, we're going to use gravity, right? It's going to fall down from its spot in the fossa up in here. But we're also going to use the digastric, the geniohyoid, and the mylohyoid muscles. Okay. I don't, oh yeah, up here it talks about the lateral pterygoid. Sometimes, and it doesn't show it in this diagram, sometimes we have lateral movement. So the lower jaw is moving side to side. So when we have that side to side movement, we're using those lateral pterygoid muscles. Okay. So this is just a brief summary for you, just looking at the elevation, the lateral movement, the retrusion, and the protrusion that we just talked about. So we've talked about the four muscles of mastication. We talked about all of the muscles that are associated with the hyoid bone. I just want to talk really briefly about the movement of the jaw and the larynx a little bit. So we have these laryngeal movements. We can feel it ourselves when we're swallowing, okay? When we're swallowing food or swallowing something that we're drinking. And we know that our larynx is moving up and down as we swallow. And it's also moving up and down as we're talking. So phonation, okay, as we're saying the words and pronouncing the words. Uh, the hyoid bone is an important part of this because we know that the muscles above it are going to pull that hyoid bone up. The muscles below it are going to pull it back down. But we have that thyrohyoid muscle as well that's going to contract and elevate that thyroid cartilage in the larynx for us too. Again, there is a video embedded here for you that you can watch, and it's all about the movements of the jaw and the larynx. So as we move down, we've talked about all those muscles on the front portion of the neck. I think we've briefly touched before on this sternocleidomastoid mastoid muscle, or the SCM muscle. It's just easier. So that muscle, we need it for tilting and rotating our head. Okay. So we know the origin of it is in the upper border of the sternum or the clavicle up in this area. Okay. That's the least moving space or portion of it, right? Origin is the least moving. And it's going to insert up here into the mastoid process of that temporal bone. Okay, right up behind our ear, because that area is going to be moving more. So we have this muscle coming down from just behind our ear in that mastoid process, coming down and across our neck and inserting down into the clavicle area. So as we move, if you put your hand there on the side, as we move our head from side to side, we're feeling that SCM muscle moving back and forth, tilting our head with us. The blood supply for this big muscle is the external carotid artery. And I just wanted to mention this muscle, lots of times we have referred pain from it. This is the muscle when, one of the muscles, I should say, when you wake up in the morning and you have that stiff neck and you just can't turn your head the right way. That's partially this muscle. But this muscle is also has some referred pain from it when we have TMJ issues as well, or if we're having some shoulder issues. Okay. So a lot of it, there's that big connection between the shoulders and the head with this SCM muscle. So we can have a problem, as I said, in the TMJ, but have that pain and that tension coming all the way down that sternocleidomastoid mastoid muscle. So running down the back of our head is our trapezius muscle. So when we activate the trapezius muscle, that's going to be us shrugging our shoulders, moving those shoulders around. The origin of this is from the occipital protuberance, okay, on the occipital bone, right here at the back of our head. And it's going to come down as we see, and it's going to insert on the back of the scapula and right back in here on the posterior portion of our shoulders for us. So when we are using this muscle, it's going to elevate, it's going to rotate a little bit our scapula around. As I said, that's kind of the shrugging of the shoulders. We know we have trapezius muscle coming down on either side. That's why we can move our shoulders independently from each other. It can also have some referred pain with it, some TMJ pain, that neck pain that's going up into the head as well, causing some headaches for us. So when we have some contraction of this muscle for a long period of time, it can have some referring headaches, as I said, or some migraines. And it can also have to do with malocclusion in some instances, or it can have some connection with TMJ pain as well. Okay, there's lots of muscles connected in around this area, and when we have really bad TMJ, again, it can hurt. It can bother us down that SCM and back down into the back with our trapezius. This slide is just showing you a couple of different quizzes. There's a really good model. I showed you that model. And there's a breakout room. Oh, do we want to go into a breakout room? No, but there's a YouTube video for us to watch. There is a worksheet project for you posted on your Blackboard page. It's in Google Docs, and I want you to work on it together. So let me just skip over to there. Okay, whoops, too many things going on. So it's this muscles of mastication page that I have for you. So it names the muscles, and then I'm looking for you to fill them in. This can be one of your cheat sheets for studying for your next test. So here's our muscle. I want you to name the origin, the insertion, the activation. You can talk about the innervation of what nerves it has as well. So there's our 4 muscles of mastication, our suprahyoid, and our infrahyoid muscles. Okay, so as a class, you can go back and work on that Google Doc for me. That's it. Thank you very much.